All right, how we do, everybody doing? Welcome back to the Healthy Elkhorn podcast. I'm here with one of our students, Jake Holtzen. Holtzen.
Yep.
I already said it wrong.
Sorry.
Holtzen. Jake goes to Midland University in Fremont, just up the road from us here. We are in the Union Bank and Trust Sports Complex in Elkhorn, Nebraska, where we have our Nebraska League volleyball. We have our Omaha Sports Academy basketball. We have the Motivera gym in the back, and then we have our Essential Motion Spine and Sports, where we have chiropractic, physical therapy, and massage therapy. So Jake is a student athlete at Midland University, and I'm just going to have him kind of just talk about what he is taking in school and what he's picked up and learned so far here with us.
I'm going to school for human performance with concentration in exercise science. I've been interested in physical therapy and both chiropractic, so this is the perfect place for me to.
It's a one-stop shop for you.
Get an internship, exactly. Yeah. So I've really enjoyed it so far. Just having physical therapy and both chiropractic, working on one patient, I think goes such a long way that not many people fully understand yet. But yeah, just the different chiropractic techniques and the physical therapy movements and exercises they've been doing, it seems like it really helps out their patients, and their patients go home happy, it seems like. So
cool. All right. So the things that you've seen so far, do you feel like there's one type of patient or one type of injury that I guess we see more often here, or that gets the most benefit from the combination? I mean, I'll start with that question, then we'll kind of dive in, because you brought up a good point where it's not that common that we have chiropractors and physical therapists not only collaborating, but actually working together in the same office. So what have you seen here so far that you thought would be like we can say the same kind of patients, or is it more certain body parts or injuries that you have seen most of?
Seems like it's good variety. The older patients, I mean, every patient benefits from both chiropractic and physical therapy. I think the older patients specifically benefit a lot because they got a lot of back pain and posture issues. And chiropractic and physical therapy helps with that. So physical therapy reinforces it. Chiropractic seems like it kind of observes it, the posture and the whatever's in the back and neck and lumbar. So
that's the thing that we have to educate, obviously our listeners on, but other practitioners as well, as what is chiropractic, what is physical therapy. So I mean, as a student, as a person who's interested in both professions, what is your take on, what do chiropractors do, or what is chiropractic care to you?
I've seen it's just the mobilization of the spine, and there's so much tension in the spine. It seems like that's the middle part where everything branches off to, right? So that's what got me interested in chiropractic. It's just relieving that tension and getting the blood circulation going again, whatever you want to call it. And just physical therapy that on top, I think, is just a great idea. So
yeah, so that's a good definition or working definition of on the chiropractic side. What comes to your mind when you think of physical therapy or a physical therapist?
Muscle imbalances, strength imbalances, I think that goes along. That's what physical therapy handles. Stability issues, mobility issues. I mean, just pretty much about everything an athlete or regular person needs to fix. People in the weight room, it just enables them to be optimal.
Okay. Yeah, I think the way we try to go about it with the combination part is, the chiropractic side is going to give the instant, very quick pain relief, and the very quick and instant relief and release of tension, like you talked about in the spine, and having that something done to the person, like, oh, that feels good to get that thing moving. I feel more relaxed. I feel more mobile, right? Like to get that tension and then, which is good. But then where it can lack at times, not all, but I mean at times would be, well, now the person still needs something to do at home. They need something to take with them so that they feel like they own the problem as well, where they can like, hey, now I know when I get home, I have these certain specific movements or exercises to help maintain this release and this feeling of freedom and movement. I mean, and reduce pain. And so in the initial phases, the combination works well to initially just decrease some pain and get some more motion, mobility, and that kind of thing going. Then the transition on the PT side, and I can speak to that just as that's my area of expertise, and that is going from that phase of treatment, the acute, more to then the remodeling. So then instead of being specific movements, it's not even really strengthening your exercises to begin with. It's just figuring out how an education to teach someone how to move, what things to avoid maybe. And then we work more on the actual strengthening, where we're actually remodeling tissue that was damaged or injured, and it's healing. Then transitioning into more of a return to function phase, where we do get into more actual strengthening. We want the muscles to be stronger. And I think we all kind of know inherently, and as an athlete, so Jake's plays football, and Jeff and I both did in college as well. So I think all of us kind of know, even deep down, that a person who is the healthier and fitter and stronger you are, the least or a lower chance or less likely chance you are to get injured.
I can speak from experience on that one.
Yeah.
Exactly.
So that's where the part comes in, where we transition to the, or the addition, the combination of that and having the physical therapy with the chiropractic and then from there going into more of a fitness and wellness program, where they may not need to come in very often, but then we can transition them to either a home or in the back of the gym we have here at Motivera, into a fitness and long-term, training and workout program to keep them as strong as possible and minimize the chance for injury. So
seems like it's kind of stepping stones almost.
Yeah, you can't skip. If you're injured, you can't skip to strengthening things if you barely have any motion. So you have to get certain things back first. There's just a phase, and a lot of it's just physiology. You can't necessarily speed up how the body heals. It just takes some time sometimes. Some things we're able to change and adjust or improve pretty quickly, and some things take a little bit of time. But all right. So any other questions for us or for the listeners, or what do you think so far with having this your first internship?
My second.
Second. Okay. What did you do the first one?
CP Physical Therapy in Fremont. Okay. So I got physical therapy part of it.
Okay.
I got chiropractic and physical therapy. So.
Okay. So do this for me then, just because I'm interested. Compare and contrast the differences between that place and this place. I mean, do we do things similarly? Do we do things different? Is it the same kind of, say patient population? Is it a whole new, like, oh, this is not better or worse? I mean, just is it different? Because there's many different ways to, we're all trained as far as like our schooling, but then after school, you kind of have to know who you want to serve, how you want to treat people, and then kind of specialize in some things. And so we know who we treat here. We definitely focus on the youth athlete in the building, and the parents of the youth athletes that come in here who are active adults as well. What did you see over at the other place?
I mean, they were good. They were great with their patients. The care, just wanting them to get better, seemed like it was there. It should be. But like here, I just feel a little more passion, if that makes any sense.
Okay.
And just like I said, the chiropractic physical therapy just seems like patients seem to be just in a little better hands, I guess, understanding that part of it too. So because there's always that physical therapy versus chiropractor feel, some stigma,
Yep, there can be some negative, connotation to that, or like, oh, they're going to take our patients, or they're going to steal our, don't go there because they don't know what they're doing.
And I sort of got that feel at the other internship, and here it's just it's off the opposite.
Yep. So. Nope. It's sometimes it's just a mindset thing. Just take the people that you work with. It at times needs to be of a similar mindset where whatever it takes to get the person better, whether it's here, whether it's someplace else, And and we'll be up, front. If we can't help someone, we're going to get them to the place that will, because they need to get. As long as you just have a, and I think passion's a good word. We definitely have that here. I mean, if you're really wanting to help people and serve and get people better, you'll figure out a way whether you can do it or not. So, okay, well, what time to continue off our afternoon? We got somebody here, so we'll finish off. Jeff's working back there, so we're gonna put the video up too put the audio up for the podcast for all your listeners, and then we'll post the video as well for anybody following on the social media. So yeah, thanks a lot. It's a pleasure having Jake here. He's been here. There's been another. Actually, I didn't interview the other guy. There's another guy. Sean, yeah. Comes as well. So maybe we'll get him on here next time.
All right.
Okay. Thanks a lot, guys.